For someone who is not having reconstructive surgery but is having an implant, we have those slides, and maybe if we could take a look at the next one, and you can see the before and the after of someone who has come in. And
this is the picture of the lady that had the breast cancer. We're out of sync again with our slides, but that is the before picture, and then probably the next one would be the after. Could we go to the next one?
All right, let's go to the next one and see.
That one should, this is the reconstructed breast. Now, as you see, at this time, this patient has not elected to have the nipple areola reconstructed, which is an optional procedure. It really, again, must be individualized, and I think one of the main things that is so unique about our type of surgery is exactly that. Anything can be operated on, but that's not the point. The point is to use judgment, to use discretion, and to be able to get a good reading on what your patient wants to do, and then be able to work with that patient to get what they want together.
All right, let's again go back to the slides and see if we can see the one who has come in and wants a breast implant, not because she needs reconstruction, but because she wants to enlarge her breasts.
This is a lady who came in, and again the complaint was she could not fit into her clothing well. She was stuck buying children's tops. Fortunately for me, I'll never have to go through this kind of what's described as torture, but I can imagine and try to be as empathetic as I can for the female that is trying to get suited up and to get the appropriate top and bottom and all to match. This particular lady and others have just told real crazy stories of not being able to find the clothes and feeling like almost that they are children. And in our society now, I think there has really become an amazing emphasis on breasts. We see it in magazines, we see it in the beauty contests, we see it everywhere, but that is, again, above and beyond what the problem is with the clothing. So the complaints at this time were she did not feel that she could buy clothing well, she felt self-confident or not confident about the appearance with that, and it was really something that had been on her mind for years.
All right, so let's look at the next slide and see what you were able to do, or this is a side angle.
Right, this is a side view, and here is after the implant surgery. Now, the surgeries again can be performed in a variety of ways. This was done above the muscle using the textured implant that we talked about before, using an incision that is made underneath the nipple areola, actually in the crease down lower.
Another very common form of surgery that we hear many people talk about is the facelift, and you have slides of before and after, which we want to take a look at those. What do you actually do in a facelift? You cut the skin, you pull it tight? What is the procedure?
Well, it's funny because it's like with the breast reconstruction. I had a lady who came in and said, well, where do you get the breast from? As if we were going to the Sears catalog and going to buy a new breast. A facelift procedure is somewhat of a misnomer. It really is a face-neck lift procedure. It really involves from the level of the cheeks down to above the collarbones, encompassing that area. It does not involve around the mouth, the wrinkling around the mouth and the wrinkling on the chin. It basically involves excess tissue, whether it be fat and skin that we find under the neck, that we call the turkey waddle on the jowls or the areas of the jawline itself, and in the nasolabial fold, which is the crease from the nose to the mouth itself. So a facelift is a face neck lift, which really encompasses from here to about here and leaves the central portion out as well as the nose and the rest.
Let's take a look at that slide of someone who came and was interested in a facelift. At what age should you start considering? I know there isn't any real rule, but at what age would you recommend someone consider a facelift?
I don't recommend anything. I am what I hope is an educator, a guide. Somebody will come to me with a concern. We will explore it. So it may be that somebody has a problem that is significant at a very young age, that particular technique can be available for, versus somebody coming in at an older age which is saying to me, well, what can I do to look better? I really want to work with the patient, and I don't want to impose my viewpoints and opinions as much as I'm looked at as being the expert and the artist with this. Where I really am concerned about is what you're thinking. Because if something doesn't bother you, then certainly it really, in my opinion, should not be broached upon by me to say, this is what you should do. If this is a concern that you have, then let's talk about it and let's see what is the anatomic story, and then let's go on to as what surgery can and cannot do.
Let's take a look at what surgery can do, and this is the after picture of the patient who did have a facelift. How long can you expect it to last?
Again, it depends on a multiple number of things. It can be whether or not your nutrition is good. It can be how your skin tone is. It's genetically determined how your wound healing will be. If you smoke cigarettes, if you drink, if you're not taking care of yourself. There are a multitude of things, including the external environment of sun exposure, that can be very deleterious to a lasting, or what we would hope to be a lasting. The generalities are anywhere between 3 and 15 years, but there are those patients that perhaps after a year will need to come back for a touch-up because of the factors that we talked about.
I want to ask how long it takes for recovery from a facelift, but at this point I want to invite our viewers to call in with any questions or comments that you might have. The number to call is 736-9935, and if you are out of our toll-free area, you may call collect. So any questions that you might have about cosmetic plastic surgery, this is your chance to ask them. Is this an overnight procedure? Is this an in-office procedure, a facelift? How long does it take?
My philosophy, and this is me, I really will not do anything other than very minor procedures in my office. I feel, in my opinion, that the safest place for a patient is to have them in a facility that is used to doing the procedures, has the appropriate equipment, the ancillary help, and if you should run into a problem, that you're going to be taken care of with the immediacy that you would expect in our day and age of what we have to offer. I think the worst thing that we can do is shortchange our patients or try and cut corners on how we're doing these things, even though we have come, unfortunately, in my opinion, to think that cosmetic surgery is more like going to the hairdresser than it is surgery. And I, for one, am very cautious and conservative in my approach towards these things. There is no such thing as minor surgery. Any surgery can have a problem with it. We try not to have those things, and one of the reasons that I go through the things that I do with my patients is to try and get them to understand, yes, the surgery hopefully will run smoothly, and usually they do. However, if we do have a problem, then you will need to be flexible with me so that I can help you. The real art and skill may come in at that time as to how to make what may be a disaster into a good outcome and go over those areas. So,
how long does it take to heal? How long should you expect to have bandages on or to not be able to go out in the sun? Or?
Again, these things are individualized. In the overview, I say for example, a facelift, probably between anywhere from 5 to 14 days where they should just be taking it easy and recuperating. I give the maximum of that about 3 weeks. Again, depending on how they heal, what their wound healing is like, and whatever. As far as bandaging, there is bandages that I use that will come off at 2, 3, and 4 days. Suture removal the same up until 10 days. The last stitches are taken out for me at 10 days. And then as far as sun exposure, I really am trying to impress upon patients that for the initial time period where there's a bruising, if there is bruising, which there usually is some degree, that those are very hot areas that need to be avoided from sun because bruising can be permanently stained by the sun exposure. After the swelling and bruising has subsided, then the permanency of the scar areas and the redness may last from 6 to 12 months or more. So I encourage patients to start with skin cream massage and using a sunscreen that is very much going to cover those areas. There is no problem in my mind from somebody who's active before to being active afterwards, as long as they understand the dynamics and are protecting themselves from causing problems to the newly freshened scars.